So when you talked about a bit about expanding waistlines and aging, hormones, what is redistribution of weight, the effect of estrogen on all of this, and sort of being teed up for metabolic syndrome? Is that the right terminology?
Yes. So let's take a moment to define what is metabolic syndrome, because that's
Okay,
what we're trying to avoid.
great.
So metabolic syndrome is basically a collection of symptoms or medical issues that if you have 3 of 5 of them, you qualify as having metabolic syndrome. And 1 in 3 adults in the United States has metabolic syndrome. So this is a very common syndrome, but it's silent. And oftentimes people recognize all the different components, but don't realize, oh my gosh, I have this syndrome and it's setting me up in life for an increased risk of cardiovascular disease, diabetes, high blood pressure, stroke, heart attack, fatty liver. And so metabolic syndrome is made up of high blood pressure. So a blood pressure read over 130/85, elevated cholesterol levels. So it could either be low HDL, which is a healthy cholesterol, elevated triglycerides, and high LDL cholesterol, increasing waist circumference. And this is actually has cutoffs based on ethnicity. So we don't want to just blanket say, oh, over 40 inches for men, over 36 inches for women. Those are general. But if you go down to say higher ethnic risk groups like Asian, South Asian, and Hispanic, those levels are actually over 36 inches for men and over 31.5 inches for women. And then also insulin resistance. So if there's signs of diabetes, pre-diabetes, and sometimes we'll check things like insulin levels to maybe identify people or women who have polycystic ovarian syndrome or have a history of gestational diabetes. We know that they're a higher risk for underlying insulin resistance. So when you have all of these 5, if you have 3 of them, you have metabolic syndrome.
Okay.
So that's the definition of it. The first part of your question was when this weight redistribution occurs, is it dependent on estrogen? And yes, it is. So a lot of times you'll see men who have that type of body shape where maybe they start to carry more weight in their midsection area. And during perimenopause and eventually menopause, we also undergo a weight redistribution. So the weight that we carry, say, around our hips is not as metabolically dangerous as when we carry it in our midsection. And that's because there's an increase in a type of fat called visceral fat, which is different than subcutaneous fat.
Okay, I'm sorry to interrupt. I got excited because I was just going to ask you about that. You were leading me to think of visceral fat. Can you let us know about that? And just to repeat, weight that's typically been around our hips, thighs, is not as dangerous metabolically as weight that begins to creep up around our midsection. And can I also just sort of insert here, if you would, because I don't want people to feel afraid either, right? And all of these changes start happening. This is a normal season of life. This isn't meant to sort of put the fear of everything into us, but rather to understand. And I know that we'll get to things that we can do and focus on to make proper changes. But can you speak just a bit before that about the visceral fat part?
Yeah. So I agree with you. I think what we want to do today and in general for my objective is to empower people. And I think part of that is to know what's happening and what things we're at risk for, what things to look out for. So this means know your blood pressure, know your labs, ask your doctor about your cholesterol, have a conversation about normal values or values that are just on the border. And maybe you hear like, oh, it's not so bad. But really, these are things that if we can take into account earlier, then there are absolutely things that we can do to help prevent the progression. And it is not inevitable that if we have these things happening, if you have just an expanding waistline, but you're practicing really good health habits, you can absolutely avoid things. So that it's not a for sure thing. But visceral fat is something that I think a lot of times, requires a little bit of thoughtfulness. And when you go to your doctor's office, oftentimes they do a weight, they do a height, and they say, here's your BMI, your body mass index.
Yes.
Well, your BMI is really not saying anything about your body composition, right? You could be all muscle and have an elevated BMI. Well, are you necessarily at risk versus maybe someone like me? I'm of South Asian background. I'm at risk at a lower BMI, which is quote unquote normal. I may be missed. And so going beyond BMI to actually think about, hey, you know what? Everyone can have access to a tape measure. Check your waist circumference. And based on those guidelines that I just mentioned for those cutoffs, empower yourself with that knowledge, have a conversation with your doctor about that. Bioimpedance scales. So in my practice, we use an in-body scale that actually measures how much muscle mass, how much body fat, and how much body water we have. And so we can then target and go, oh, okay, my visceral fat is creeping up. Maybe that's something that needs to be brought to my attention and be more of a focal point. The gold standard to assess visceral fat is an MRI. Well, not many of us are going around getting MRIs, right? But there are DEXA scans available, the same type of test that we do for bone density. There are places that do DEXA scans to identify how much visceral fat we have. So part of this is like saying, hey, what are the things I'm potentially looking for? And what are my numbers? And then we can talk about what things we can do to make ourselves in a better position in terms of our metabolic risk.